Welcome, everybody. We see you all filtering in. We're so glad to have you here. We're going to give people just a minute or two more to get logged in, get settled in, things like that, and then we'll get started. All right. Well, welcome everyone to our October Community Engagement Forum. I'm so glad to have you all here. And I'm going to kick us off this morning. I noticed we still have a few people filtering in, but in the interest of time, I really want to make sure we have great discussion with our presenters. So we are going to go ahead and get started. Jordan, if you don't mind pulling up our intro slides, I'd appreciate that. Today, I will start by welcoming you all. Our series theme this year is From Principles to Practice, Engaging Underserved Communities for Multi-Level Impact. So we are really building on last year's Community Engagement Forum series that was focused on the principles of CVPR and what those look like. And this year, we're thinking about how do we take those principles and really apply them in real-world research projects in a way that can be impactful on the disparities and promote health equity in communities. So today we are focusing on putting these principles into practice, and we're hearing from two successful community engagement pilot grantee partnerships. A few upcoming events and things that are going to be of interest to many of you. So the slide you see right now, CCTSI and Accords provide community engagement consultations. If you are looking to build partnership with communities, please take a minute to request a consultation, get input from some of our teams. Next, coming soon, and what you'll hear a lot about today are CCTSI community engagement pilot grants. Jordan, if we can control when those slides go back and forth. Thank you. Community engagement and health equity pilot grants, those RFAs are going to be released on Monday. So those are coming up. And then pilot grant application webinars are in just a couple of weeks on November 11th from 12 to 1. You can get more information on that link there, the CCTSI website. Another announcement, if you have attended some of these or if you've missed some of our community engagement forums in the past, those are also available online, CCTSI website under the Community Engagement and Health Equity Core. And then also, if you are new to us, if you have not heard of Accords, a little bit about who and what we are. So this is our Adult and Child Center for Outcomes Research and Delivery Science. We partner very closely with CCTSI and the Community Engagement Health Equity Core on these community engagement forums. What is Accords? It's a little bit of a one-stop shop for pragmatic research. If you are in that T3, T4 end of the translational science spectrum, we have resources to help you do your work. We are a multidisciplinary and collaborative research environment, 14 methodological cores and programs that are led by national experts. We provide consultation and team building for grant proposals and extensive educational offerings, mentorship, training, and support for your work. So check out Accords. We also have a bunch of upcoming events. So next week, we have the next in our series on digital health and clinical informatics with Kathy Bodine. The week after, we have a special guest lecturer, Alana Kolchak-Ram from NIH, program officer at NIH, is coming to talk about implementation, science, and precision health. The following week, we have another in our digital health series with Clint Carlson talking about AI-powered avatar simulations. And then in December, we are launching our series on learning health systems, multiple perspectives for mutual gain. And we have Eddie Stenheim presenting on December 4th. And that one, I'll just point out, our time is a little different than our usual seminars. We are doing a late afternoon presentation and then networking with Eddie on December 4th. On December 9th, we'll have the fourth in our digital health series with Amy Collier. And then a save the date for everyone. The Colorado Pragmatic Research and Health Conference is scheduled for June 4th and 5th. So it's a Wednesday, Thursday. And we hope that you will all consider attending and joining us for that event. All right. I am going to hand over the reins to Don Neese, who's going to spend some time talking about that community engagement pilot grantee program to get us kicked off today. So, Don, welcome.
Thanks, Sarah. And I've already unmuted. So, okay, there we go. So great to be with you all today. Thanks for joining us. We're excited to have a couple of our teams of community engagement pilot grantees with us. And as Sarah mentioned, on Monday, we'll be releasing the request for applications for our next round, our next cycle of community engagement and health equity pilot grants. I direct our CCTSI Community Engagement and Health Equity Program and core with CCTSI. And so I'm going to run through just a few slides to give you a little bit of background and context about the pilot grant program, what each of the tier grants are about, and who's eligible to apply. So our partnership development grant is the first tier. It's an $8,000 grant that funds you over 9 months. And then our joint pilots are $30,000 over a 12-month period. The idea is that our partnership development projects or awardees will then go on to apply for a joint pilot project if everything goes well during the partnership development phase. Joint pilots, though, are not required to do a partnership development first if they've already got an existing well-functioning partnership. I've already mentioned that our cycle is going to open on Monday. And if you go to our website by scanning that QR code, you can also view our previous RFA that's out there right now and some of the FAQs if you want to get a little head start. Next slide. So again, partnership development, we feel like this is a pretty unique and important part of our program. It's really intended to support new or potential partnerships. So it's pretty rare that you can get funding to actually spend time with a community partner to build relationships and see if it makes sense to work together. But that's really what this is for. So you get 9 months of funding to explore your areas of interest, how you might work together, and start thinking about and developing, if all goes well, a proposal for submission as a one-year joint pilot project. Each of these is reviewed separately, so just because you have a partnership development doesn't guarantee you a funding of a joint pilot, but definitely can get you launched on your partnership and give you that really important time to form those relationships. We always like folks to consider allocating a minimum of 50% of your funds to the community partner that you're working with. And so that's something to keep in mind. So what are potential activities? Building relationships between partners, exploring those shared research interests. Um, Awardees have used this time to develop an advisory committee or some other sort of infrastructure that might guide your work going forward. Um, Occasionally, we'll get applications that are, focused on getting focus groups as input. I'll just say parenthetically, on Monday, I was at a pre-meeting at the Patient-Centered Outcomes Research Institute, pre to their annual meeting, which is happening right now, but really focused on their new guidelines or requirements for engagement. Like them, we don't consider just getting input as real engagement. So you need to go beyond that. Um, Other things that you can do in this is, evaluate your partnership process. And again, like I mentioned, develop that research plan and proposal for a joint pilot. Moving on to the joint pilot, that's really intended to then go to the next tier. Support investigators that have an established partnership in place. There's support for a whole variety of different kinds of things that you might do in the community as a community engaged researcher CBPR project. Um, we do have a strict requirement that things have to be completed within 12 months because of some of the restrictions on our funding. We can't go beyond that. You do get $30,000 for that work. Again, we encourage folks to consider allocating a minimum of 50% to your community partner. And I should mention, I didn't mention before that this is really done as a co-PI, so academic and community PI sort of funding. Potential activities that you consider within a joint pilot is to test the feasibility, duration, cost of a study design, implement a small scale study. We're really interested in things that you might be able to use to get that pilot data or feasibility data that allow you to apply for more funding down the road. That's really important. And we also, one of the things that we really want folks to think about is even with a pilot, how you're going to translate what you found back to the community that you're working in. So this is just a schedule of dates. Again, Mondays are RFA release. We do have a mandatory um, a letter of intent that's required. Those need to be submitted by the 11th of December. And then our application deadline is at the end of January. Um, we'll go through our review process, which is kind of unique in that all of the applications are reviewed by pairs, an academic and a community reviewer, and there are two teams that will review each submitted proposal, and then we get together in a typical study section kind of format to discuss the scores and the applications. Um, by June, we'll be able to notify those who've been selected for funding. We have some training that goes on around how to manage the finances, just some other expectations that we have. That's part of that mandatory training. And then the anticipated start date will be in August, and partnership development grants completion by the end of May of 26, and the joint pilots by the end of July of 26. Like I mentioned, all projects have to have both a community and academic partner identified at the time that the application is submitted. Um, we really encourage you, and you'll see this when you get the RFA, that this is something that you develop jointly, whether it's a partnership development or a joint pilot application. Um, and in terms of the community principal investigator or co-principal investigator, These are often folks who work in community-based organizations, state or local government, could be a faith-based organization, community health practice, and we also have had community researchers who may be independent contractors but not attached to any one organization. So if you have questions, we'd encourage you to just pop those into the chat box during our meeting today. We'll try to get those answered, and you're always welcome to email us at the address on the slide. And with that, I'm going to transition to the main event here, and that's a discussion with a couple of our prior awardees, couple of our prior awardee teams, I should say. And Adrian Miller is going to be our moderator today. If you've not been with us in previous forums, Adrian is a community member of our planning committee for these forums. And Adrian, good to have you with us as always. I'll pass the baton to you.
All right. Thank you, Don. Good to be with you all. So before we get going, I just wanted to share my own experience being in one of these partnerships. So I'm the executive director of the Colorado Council of Churches. And if you don't know about that organization, we are a coming together of 13 Christian denominations across Colorado, representing over 600 churches. So one day I got a random email from Dr. Joshua Williams, who was affiliated with Denver Health. And he said, hey, I want to explore faith community attitudes towards vaccinations. Not the average email that I get. And so it was right on time though, because I had been thinking about ways to get churches connected to their communities in ways that people didn't expect. And so it was really from that email that Dr. Josh, as I call him, and I started to talk. And we ended up doing a project where even though I deal with Christian communities, we had an interfaith approach. And so we met with people, clergy and lay people, at Christian churches, at a synagogue, and also at a Buddhist community, just to talk about are vaccinations something that's discussed, in your sacred community? If so, what are the attitudes towards that? And one of the things that was driving this was just we were seeing a spike in exemptions from vaccinations in Colorado, and a lot of people were citing religion for that. And so we explored that. And not only did we have 1 year of doing this, but then we got a second grant where we really focused on Black communities and attitudes towards vaccinations. And this was during the height of the pandemic. And so it was a very, very fascinating project. So that's just an example of something that's out of the box, but it was a wonderful collaboration, learned a lot, and enjoyed working with Dr. Josh. And I'm going to speak for myself, not for him. I would say that we're friends, but if you see him, you may want to verify that. So that is my background doing this. And I really encourage you to really be creative in terms of the community partners that you might seek out for collaboration. So with that, I want our starring attractions to give further introductions of themselves. So I'm going to turn it over to Mary Ann and Gretchen. Oh, yep, there you go.
Okay, unmute. Thanks for that message. Can you pull up the slides, Jordan or Mary, whoever? So this is just introduced as our family puppet project. The title of our project, though, was addressing disparities in early brain and child development. I represent the community through a nonprofit, Parents for Parity, and you'll see our logo down below just so you recognize it going forward. And Gretchen?
I think our next slide. I'm having some technical difficulties, so I've switched to my phone. So hopefully,
okay,
you can all hear me. But we can go to the next slide.
All right, so I'm Mary Ann Bash. I'm the founder of Parents for Parity, a very, very small 501c3. It's a nonprofit that's led by parents in a very limited resource community. But that community is so rich with cultures and language. And what our goal is to ensure the families in our community have equity, parity, in education, health, nutrition, and the environment. It is the parents that over time discovered they were facing a lot of disparities in those areas. So one of our education programs is the Family Puppet Project, which is families with newborns.
And I'm Gretchen Domek. I'm an associate professor at the University of Anschutz, and I'm a primary care pediatrician at the Child Health Clinic at Children's Hospital. And then I'm also an Accords researcher who studies interventions to promote early childhood development, especially in resource-limited settings, both here in the US and abroad. Next slide. So just to give you a very brief background about our project, what really brought Marianne and I together is our mutual understanding of how critical the early home language environment is for children's future vocabulary growth and ultimately their school readiness. And yet there are few evidence-based, simple, scalable interventions that exist to support that early language promotion. And that's especially true in the newborn period. So our study team at the university developed an intervention, a very simple intervention about a decade ago using finger puppets to promote the quantity and quality of infant-directed speech and to improve caregiver-infant interactions. And we actually first developed the intervention in Guatemala through the Center for Global Health. We did it in China and the country of Jordan. And then about a little over 5 years ago, we started studying it here in the US at the Child Health Clinic. And we did a couple of initial pilot studies that had really promising results in the primary care setting. Our community academic partnership then with Marianne was established 4 years ago. And really our initial specific aim was to improve the delivery and reach of this simple intervention in the community and specifically the Montbello environment. And since then, as we've expanded over 4 years, we've been able to now go to other communities. And I think while it wasn't necessarily one of our initial aims, one of the real benefits of this partnership has been that we've improved the intervention for the clinical setting as well. So I guess it shouldn't come as a surprise that our community members have helped us make it a better intervention overall, but that had not been the initial aim. And it certainly is a much better intervention that we're now studying in the clinic as well.
And we can stop our slides there.
All right, sounds good. Thank you. We'll come back to you in a moment. So now we'll have Dee and Patrick introduce themselves.
I'm Pat Romani. I'm an associate professor in the Division of Developmental Pediatrics at Children's Hospital Colorado. And I'll give Dee a moment to introduce herself.
Hi, everyone. My name is Dee Laba. I'm with Otero County Public Health Department, and I work in primary prevention in the Communities That Care model. And we focus on communities organizing for prevention through coalition building.
So Dee and I were partners on a partnership development grant that we were awarded in 2023. The goal of that project really was to build an advisory committee, build a community coalition that is interested in working on and understanding opportunities for growth and refinement in youth mental and behavioral health in Southeast Colorado. So we were able to, as part of that project, we conducted a needs assessment with community members of different healthcare disciplines, education, parents, kids themselves, to then kind of as an advisory committee understand what's going well with regards to youth mental and behavioral health, and then what are opportunities. You can go to the next slide. So Dee, I mean, I noticed this too, but Dee really has kind of led a lot of this, kind of using our information and then translating it into what we can do with it. So, our advisory council, as we were collecting information, one of the themes that came out was the lack of after school or extracurricular activities available for youth in the community. And what we've noticed was that social media was very prevalent, the usage of social media, and that kids on kind of the unhealthy end of the spectrum were going to school and having difficulties with their peer groups there, and then going home and having those same difficulties on social media. So you really couldn't escape it. And around that same time, the Surgeon General issued an advisory regarding the effects of social media on youth mental health. And so that really got us thinking that this might be one area that we can intervene on and then go ahead and have some success with to make a real difference in the community. I'll talk about the purpose, but then I want to give Dee a moment. She's talk about the Digital Futures Initiative, which is the intervention we're hoping to pilot. But our goal really is to empower adolescents and adults in La Junta and Los Animas and some of the surrounding areas in Southeast Colorado to be able to speak to their peers about the risks of social media on youth mental health. Dee, do you want to talk? Could you talk a little bit about the Digital Futures Initiative really quick?
Sure. So I'm also a volunteer with my school district. I serve as the president of the Board of Education, and I attended our Colorado Safe School Summit, and that's where I was introduced to Digital Futures Initiative, which is a curriculum that was developed by school resource officers, and it's free. And it addresses a lot of things that have to do with youth, their digital citizenship, but especially like their emotional quotient and relationships, and then other things like distracted driving and things like that. But it's in a more organized way that we can deliver it to our youth, but it can also be taught by either older teens like our seniors, so that develops this opportunity for mentorship for our younger students, or it can have we can engage with our retired community if they want to do some of the teaching some of the lessons. And it's just a way to try to bring back like a, what would we call that, multi-generational or cross-generational kind of interaction with our community to get us back to connecting with each other. Some of the scary things that we were talking about when I was at that Safe School Summit is we can have kids that are sitting next to us, and we're talking about junior high, sometimes younger, and we could all be in the living room, you know, just kind of on our phones, kind of watching TV, but sharing the same space, but not realize that our students are actually being harmed right next to us with information, like somebody's trying to extort them for racy pictures, or threatening them or their family for things like that. And we don't realize how fast and how out in the open it is. So we wanted to make sure that we gave parents the tools to understand how to better support their kids and give them the opportunity to have those conversations. Because you don't think about asking your kid like, hey, what's going on with your, you know, I don't know very many parents that actually still read their kids' text messages, or let me look at your Snapchat, or know that you can hide your apps now on your phone and make it so that you can't access them unless you have like your face or your fingerprint and things like that. And sometimes just being more aware of technology will help them keep their kids safe.
Thanks. All right. So let's go to the questions that I have for all of you. And please, for those who are watching, put your questions in the chat, and we'll try to get to them as many of them as we can before our time is up. So I'm very fascinated by origin stories. So I'm very interested in how the academic partners found the people that they decided to work with. So maybe Pat and Gretchen, if you could talk about that. So Pat, why don't you go first to just tell us you know, what got you interested in Dee's organization? I know you're doing social media. Was it because she had a very compelling dance video on TikTok, or was it something else?
Yes, that is part of it. I think what drew me to kind of wanting to just continue this partnership is really, you know, Dee has so much energy and dedication to her community, and just talking to her, you have all sorts of information and ideas just flowing. And there's so much richness there that I felt like, you know, that excitement it was really what drew me to kind of to Dee, to the Southeast Colorado community. And I think just being able to continue that work and to be able to have a community-based impact using people that, you know, with people that are so enthusiastic and have great ideas was really cool. And that's what drew me to continue this work after our partnership development project ended.
And how did you actually approach Dee? What was the initial communication?
I participated in one of the CCTSI programs, that was the immersion program, and was able to go to Southeast Colorado and spend a week there, and was able to meet with Dee and others, and that was kind of our first introduction, and just understanding the community impact that Otero County Public Health has, and was really kind of that first introduction. And then when the partnership development RFA came out, I kind of reached back out and to Dee and others we had interacted with and said, hey, do you remember me? And and then we were able to kind of forge a path forward from that. But yeah, that was the immersion training was my first really introduction to the team that we have now.
All right, and Dee, can tell us what you were thinking. Why did you return Pat's phone call?
I think first it was just, again, had to do with energy. He was really excited about the project that he was putting forth, but I really had a passion, or still do have a passion, for youth mental health. I see a lot of issues in our area. I think it wasn't that long ago. I want to say they're juniors now. So our junior class right now, they when they were in sixth grade, started their sixth grade year, they lost one of their classmates. He hung himself before the school year started, and it has had such a lasting impact on this specific graduating class that they still take pictures of, if they at homecoming, when they won like the class lip sync, things like that, they still take pictures and have like his picture in their group picture and things like that. And he was only in sixth grade. So when Pat said that he wanted to kind of address the issues of, or really research like how easy or difficult it is for folks to access our mental health resources in the area, I was really passionate about that, and I wanted to be part of it, to understand how could something like this happen, like where was there disconnection between family and school, or did we just not see it? Was he good at hiding his pain? Like where did we fall short for this child? And I just want to try to make sure that we don't have that happen again.
Okay, thank you. Gretchen, tell us how you got connected.
Okay, my computer's working again. So we had actually, I had, with another researcher at UCD, had contacted an organization, and we sort of contacted them out of the blue, emailed them and asked if they'd be interested. We had this program in Guatemala that was much more than just the finger puppets, and we were wondering if they would be able to implement it. And they were interested. We met a couple times, put together an application in 2019. We did not get the partnership development grant, and we had good feedback. I think some of the criticisms were that we didn't have letters of support, and maybe it was a little obvious that we were so new. We had only met a couple times and really were at the very beginning stage. And so then in 2020, we went back to them and said, now we've established a little more work together. Would you be interested? And they were really overwhelmed with COVID and said, now is just not a good time. And so, so we sat 2020 out, and then in 2021, the stars aligned, and Marianne, now if we have the slides, can tell you how we came together.
You have the slides ready?
You have the slide of Bonnie.
There we go. There we go. So just a little of my background. Again, I loved, Adrian, what you said. You never know exactly where a partnership might exist or be lurking. I actually have taught in public schools, under-resourced public schools, since 1970. I also had a mentor for 50 years. I wrote and published 3 curricula that led students to exceed achievement of match control students. So I had some research background. But most importantly, I had earned long-lasting relationships with families in the Mount Bello community. And I want to talk about that community a little bit in a minute. But Dr. Steve Berman planned a 90th birthday party for Dr. Bonnie Camp, Professor Emeritus of Pediatrics. And he invited me because Bonnie had been a 50-year mentor for me, and he invited Gretchen, who Bonnie had mentored for the last decade, to be presenters at her 90th birthday celebration. So Gretchen and I met virtually, and Bonnie Camp was determined that we would begin working together, two of her mentees. So that's really what brought us together. So, okay. Yeah, go. Adrian, your turn.
Oh, okay. All right. If each of you could just talk about why you decided to apply for a CCTSI grant, that would be really illuminating for folks. So, and we have a few more questions. So, if you could make it a little concise, that would be great. So, Gretchen, why don't you go ahead?
Can you put that slide back up real quickly? The funding one. So in 2021, then, Marianne had an opportunity for a grant through the Office of Children's Affairs. And it was for the early infant period, which she had worked with older children in the school ages. And so after that birthday party, we said, gee, we have a project. I have a project. I'm looking for a community partner. You've got a grant opportunity. So we got this initial funding from the OCA. And this really started the partnership, it helped us create some of the materials together. But then in 2022, we were able to apply for the partnership development grant. And like Dawn said, this is just such an awesome opportunity to really just focus on developing your partnership. And we hadn't done that with the OCA grant. And so this gave us the opportunity for 9 months to formalize that partnership. We created a very successful CAB, a community advisory board with Montbello families. Initially, we had told them we'd meet once a month. They wanted to meet weekly during the period. And so that grant just helped us solidify and get more formal an outline of our roles and responsibilities so that we were really ready in 2023 then to do the joint pilot project where we conducted key informant interviews and have really been able to identify barriers and facilitators to making this intervention even better in the future. So next slide, we'll just show a couple things real quickly. So these are some of the forms we were able to create in that initial OCA grant. And that's when the CCTSI one came along, then it was kind of a no-brainer to see if we could really develop this partnership and take it to the next step. And then I think there's one more slide.
Well, I think this tells our story best. That original Denver Office of Children's Affairs grant, we met all of these families. Actually, most of them had been former students of mine. They are the ones that taught us how to create those videos and those teaching materials. Everything is bilingual. We have everything in English and Spanish. But the untold stories here, and I so appreciate Dee and Patrick. One of these families has a child who social media predation separated the family and put the 11-year-old in juvenile detention for a full year, a devastating impact. One of the families here was homeless for 3 years. One of the families here was separated. Dad was in one country, mom was in another because of immigration prohibitions. One of these families was in a tragic car accident. And so one of the twins she was carrying was killed, and the other twin was born so prematurely that they are seriously cognitively and physically delayed. But these are the parents. This is our community. So it tells us that we're reaching exactly who we wanted to impact through this project.
All right, thank you. Pat, why don't you tell us why you guys decided to apply for this grant, and then it would be interesting to just follow up and just say, like, talk to us about how you defined your community and the level of service.
Mm-hmm. Yeah, so I think I mentioned earlier the Colorado immersion training, and that program really provided me with a lot of opportunity and mentorship to kind of build, to really think about community-based intervention and research. And so I think that was their kind of seeing how folks have been successful, kind of forging a path in community-based research and making community-based change towards health equity, starting the process of, building the advisory committee, kind of identifying needs and what's needed and how to then intervene on that, it was clear that that was one of our first steps if we were going to continue our partnership. And so the CCTSI awards build on each other so nicely. The partnership development grant really sets you up to have a strong core of people in the community, academic partners that have ideas. And then the pilot grant really is that encouragement to start intervening and to see what it's like to put together a community-based project and let it flourish in your community. So I think that was what drew us to the CCTSI grants and how we hope to continue our partnership, and understanding that a lot of this work does require funding, that, we all have very busy lives, and while we are all very committed to this goal of improving youth mental health, we do need some funding in order to kind of be a catalyst towards our movement. So I think this is all kind of part of our game plan to build that sustainable partnership. And I would love, Dee's thoughts on this as well, but, to define our community, I think from my perspective, our community really are those youth and their parents, and then the folks that serve that group and how they think about youth mental health. So that's really the key stakeholders in students' lives that kind of help and guide those kids through the inevitable difficulties that we all experience in junior high and in high school and so forth. And within Southeast Colorado, our community really was those families that are potentially underserved, aren't able to access resources. So sometimes it's difficult to travel to find mental health resources or the right specialty types of resources like psychiatry. And so we wanted that to be our community, and that the community that we could represent and support. Dee, I don't know if you have anything you want to add to that too, in terms of really who we're here for to help.
So I agree with everything that you said, but then that's what makes this partnership interesting, right? Because then I'm on the community side of it. So even though that you had, you built those relationships and you got to know folks when you came down, starting with the immersion grant, but I think that what helps this partnership work is that from my part of it, this is where I grew up. I know these people. I live there. I voted for some of them that are in office, and I worked in some of the stores as a teenager in my after school job, and I've babysat some of these kids that are now parents themselves. So it's, I think, really important that when you have this type of partnership, that you cover the whole spectrum, because then you can really make a more collective impact on the work that you're trying to do. And the way that I remember us getting into the pilot grant part was, and it might be just, just one of my things where I'm off on another project trying to figure something out of what to do with my time. And then Pat was like, "Hey, I'm going to apply for a grant. You want to hang out too?" And I'm like, "Oh, that'd be fun." So it was more of like, "Hey, I'm going to go do this thing." And I was like, "Well, me too. I want to come along for the ride." So, and now here we are, and we received the funding, and he's right. You can't do some of these things without some financial support. And I think that it's, I don't know, I'm starting to get like, it's just really exciting to have this opportunity that we can do these types of things in our community, to see like, is this something that we can do? It's just enough to see, like, does this make enough of an impact that we want to apply for more funding and expand it on a larger scale? Or, maybe we can tweak that and come back again. So I really like that opportunity. And I'm really thankful that Patrick thought of me to bring me on this journey.
Great. And Dee, I'm going to stay with you for this next question. By no means am I trying to project my own experiences on everyone else, but in my relationships, there's a honeymoon phase and then reality sets in. So, there's challenges. So I'm just wondering, what kind of challenges have you had in your partnership?
So I think, and Pat, you can tell me if I'm wrong, but I think that I'm the frustrating one because I'm all over the place and like Pat has his, he's got his to-do list and here's the things, here's what we got to do next. It needs to be done by. I'm like, "Oh yeah, I'll get to that. I'll get to that." Well, I mean, I'm here for this panel, but I'm also in a conference for school board for I don't even know where I am. For student education to help us with the strategic planning. And then I've got to leave because I'm getting on a plane to go see my daughter in Texas tomorrow. And so I'm all over the place. And I know that can be frustrating, but I like that he's patient and he's like, "Oh my gosh, I'll just text her and say, hey, we had a meeting." And I'm like, "Sorry, I was in traffic." But he's very forgiving and he understands that. Like you said before, we're very busy. Like this project is a small piece of the things that we do separately. Um, and so I think that having some grace so that we can do the work is really important. And I would say that I'm the one that's, if it was a honeymoon phase, I'm the one that like leaves the lights on and steals the covers and snores if that's the case. So sorry, Pat.
Got you. Pat, knowing that this is being recorded, do you want to go on record about how frustrating Dee is, or would you like to add
How
something?
much time do we have? No, I'm just kidding. I don't think I'm not frustrated with that. I think like Dee said that, we're a partnership. I think we each have strengths and we bring those strengths to the table. And and flexibility is necessary within any relationship. And I think that throughout this process, we've gotten to know each other and how to work best together. And I think that's not frustrating, but then we know how are we going to connect and how are we going to move things forward? And I think that's the growing part that's so valuable within a good partnership.
All right, thank you. All right, Gretchen and Marianne, sometimes things don't go as you planned when you do these projects and you got to pivot. And I know that I had to do that with Dr. Josh because we weren't getting the kind of data that we wanted. So I'm just wondering what happened during the course of your journey together that caused you to reevaluate and maybe change up what you were doing?
Yeah, I think we've had to pivot a few times. But one thing I think really relevant to anyone applying for the joint pilot project, we had a lot of challenges with our IRB application. And I think, so it took over 3 months. We eventually got exempt status, but we essentially had to rewrite it. And with that delay, change how our project was done. I think one of the main issues had been how we framed it. And so using CBPR principles for a couple of years, we really viewed our partnership as equal. The community was highly involved in the research part of it, and the IRB didn't want to see that. They really, if our moms were collecting research, there were regulatory issues to that, and they would need to do city training, and so ultimately we had to rewrite it, and instead of saying we, it was, Marianne, Parents for Parity, they are doing the program. We are doing the evaluation from UCD, and we had to completely separate it in the IRB application to be a program evaluation and get exempt status. And the alternative was going to not be feasible for us. So I think for anyone, we did meet with the IRB a little bit beforehand, but I would have had much lengthier conversations with the IRB before even starting the application. Simple things like not calling it a study or research, but it's an evaluation. Just learning that wordsmithing that is really important. And since then, I've had a similar project go through very easily because we had learned and did that from the beginning. So I think that was one thing I didn't anticipate, and it was really reframing how we thought about our partnership in a way I didn't want to reframe, but I think for the IRB we had to. And so because of that, then we were going to do focus groups and we just weren't going to have time. I think it was actually a really good pivot. We did just key informant interviews for both our caregivers and our community organizations, so they're easier to compare. They were so much easier to do over Zoom, easier to arrange with our busy moms. It would have been really, really hard to try to coordinate focus groups. So I think the change ended up being a good one, but it was a very frustrating 3 months, and you know, there's some concern we wouldn't be able to finish the project, which we were able to do.
All right, we have about 5 minutes left. I just wanted to check and see if we have any questions. Up, don't see any. Okay, so kind of close out, and I'll have each of you answer this. You know, your academic side, community partners side of the relationship. What was the most beneficial thing you felt that you brought to the table in either role? So I'll have Gretchen go first, and then we'll go Marianne, and then Pat, and then end it with Dee.
Well, I think, you know, originally I brought this intervention that I didn't know what to do with in the community setting. And so that's where, you know, I had this idea and this intervention, but I needed Marianne's help in a big way. So hopefully I brought something there to the table. And then, you know, I think in the evaluation process, you know, I think Andrea's on the line here and she helped run our qualitative part. You know, we really were able to run that through the university and got some good feedback and data, qualitative data.
All right. Dee, so we got a question come in, so I want to leave time for that. So I'm gonna have Dee kind of answer that question. What do you felt like you brought to the table that was really beneficial?
I think it's just that I like to look at things from all different perspectives. So I try to put myself in other people's shoes and then bring in like how can we approach something that may not you know, it won't go over as easily or as smoothly as we thought we would if we were trying to like go into the schools or we're trying to come and talk to parents. And so I try to bring my experiences of just working with different folks in the community, whether it's faith-based, judicial, or educators or law enforcement or anything like that, so that we can kind of hone our approaches in a way that's more beneficial. We're not wasting people's time, and it feels like it's getting the work done instead of us being like, well, that was kind of, you know, it's kind of like when you're asking survey questions, you're not really asking great questions, and then it's like, well, what do we do with this now? So just kind of trying to like look at all the things in the back.
All right, here's a fantastic relationship type question that we got in the chat. It's about money. So what type of activities did you plan for or budget for in your partnership development phase, and how did you come to consensus on that? So how about we have one person from each partnership answer that question? Whoever wants to go first. We have a couple of minutes left.
I can.
Marianne, yeah, you want to go, Marianne? Go ahead, Marianne. You're muted though.
Sorry. A huge part for us was the incentives that we could offer to the parents in the community. What I brought to this relationship was these long, I'm talking, Marbella was founded in 1965 and I started there in 1970. So that's how long I've known the families in the community. It's under-resourced. So any time that they spent with us, they deserved incentives and reimbursements. So that was a huge part of how we funded this. Because the finger puppets themselves are, you know, they're cheap, but paying people to attend the meetings, to reach out to others, to be part of our community advisory board, et cetera, was a huge part of our budget.
And it was another way we got to support the community.
Gotcha. Okay. Pat or Dee?
Yeah, I think it's very similar for us. I think that anytime that you're asking folks to take time out of their day, even sometimes during the working hours, that you know, having that incentive and reimbursement for their valuable time is really important. So that was a big part of our budget. Other things that we budgeted for kind of similar in a similar idea is that is like food and drink for people there. We had some built out for childcare if, you know, families needed that. And so just trying to think through all the different barriers that might prevent somebody from being able to be with us and to see how we could help address that. It was how we kind of built a lot of the budget.
All right. Thank you so much. Well, our time is up. See how that flew by so quickly. So I'm going to turn it over to Sarah Brewer to close this out. But thank you so much for sharing your experience with others. And I hope it sparks some interesting collaborations going forward. Sarah, all yours.
Well, I will start by just thanking all of you, Adrian, for moderating a wonderful conversation, but especially Patrick and Dee and Marianne and Gretchen for sharing your experiences from how you even met each other and started working together, and then some of the challenges and ins and outs of you know, what's happened in your pilot and partnership development grant projects and your partnerships overall. So thank you so much for being here and sharing your experiences with all of us. Really appreciate it. I will start my wrap up with reminding everyone that the RFAs for those partnership development and those pilot grants will release on Monday, October 28th. And I believe we'll work on getting those links in the chat so you can hold on to those links, click on them now, bookmark them, and look for those RFAs coming out on Monday. I will also remind everyone that if you want to be on the listserv to get that in your email, we also have a link for people to sign up for those emails from community engagement, health equity, and from Accords Education. Jordan's already dropped in the chat the link for our evaluation. We really hope you'll spend a minute and a half filling out that evaluation for us. We take your feedback really seriously. Most of the topics that we are covering this year are because you all told us last year that those are topics you wanted to hear about. So we selected pilot and partnership grants that fit with topics you all told us you wanted to hear. We're presenting about the grant programs because people asked about, how do I get started? What are the funding mechanisms to help me start my partnerships? So tell us what you're interested in so we can tailor our upcoming community engagement forums to meet your needs and help you do community engaged work better. Our next forum is on January 22nd. Same time, same place. We will see you back on Zoom, January 22nd. And then the last in our series this year will be on April 4th. It is our community engagement showcase, and it will be in person here on the Anschutz Medical Campus. We'll be in Krugman Hall in the next building over from what you see behind me. But we hope to see many or all of you here on campus to meet academic partners if you are from the community, or meet community partners if you are already here on campus. This was a wonderful success last year, bringing people together, and we look forward to having you all here again for our community engagement showcase on April 4th. Okay, thank you all for being here, and have a wonderful afternoon. And for our presenters, just a reminder, we'll stand for a couple minutes. All right, thank you, everyone.